Hello, everyone, and welcome to angelMD's Syndicate presentation for Heart Hero. On the webinar with us today is one of our Syndicate leads, Dr. Bill Quirk, an emergency medicine physician from the Denver area, along with Heart Hero CEO and founder, Gary Montague. One of our other Syndicate leads joining us is Dr. Carrie Mendoza, an emergency medicine physician from the Chicago area. And our third Syndicate leader is Zach Love, an experienced angel investor from the Denver area. Heart Hero is a Denver, Colorado-based company seeking to completely revolutionize the usage of AEDs to ultimately change the dismal outcome rates associated with sudden cardiac arrest. For more information on Heart Hero, please visit their profile page on angelMD.co, as well as what is available here on the Syndicate page. Dr. Quirk, I'd now like for you to take a minute to give a brief introduction on how you became involved and interested with the Heart Hero opportunity.
Thanks, John. I became involved in Heart Hero mainly out of frustration and medical frustration as a physician. From practicing for 25 years, I've really not seen an improvement in the outcomes of sudden cardiac arrest. I've had the honor of working with Gary Montague, the CEO, and Dr. Mendoza in Denver, and we really just got frustrated and said there's got to be a better way to do this. And we think Heart Hero, a portable, accessible AED, is the way to do this. If you make it affordable and portable, you'll have greater access and the time to shock will be decreased. On a secondary basis, on an investor basis, I look at it as a legacy. I want to tell my children and my grandchildren that I was involved in this incredibly important project as we're walking through the airport. And with that, I will introduce Gary Montague, the CEO and founder of Heart Hero.
Great. Thank you, Dr. Quirk. As you stated, I am the CEO founder, Gary Montague of Heart Hero. Heart Hero came to fruition really and had an epiphany when I was at about 16,000 feet when I was formerly working for the CIA as a medical officer. And it was at that time around 2013, 2012 that this kind of started rumbling in the back of my head. Why are defibrillators so big? When I left the CIA, that idea was still going on and nobody has capitalized on it, looking at the bigger situation. So I started doing some due diligence and looking at the numbers. And that led me to another epiphany. And the epiphany is that 86 million Americans are walking around today with risk factors for cardiac arrest. And 12 million of them actually have risk factors for high risk. And where this became an epiphany for me was realizing the grave number of people that are at risk and understanding that cardiac arrest is the #1 greatest killer, and it's going to kill more people this year than breast, lung, colon, and prostate cancer combined. How do we make an impactful solution to that? So we started looking at more of the numbers and really understanding from our perspective of CPR versus early defibrillation. And I started looking at the studies and data around CPR and what we push out. And CPR has a lot of relevance to our society. It is the best choice that we have right now. However, the reality is we have about an 8% chance at survivability if your loved one goes down at home and you're waiting for an ambulance to get there. So odds are you're not going to have another moment with that. If early defibrillation happened and there was an AED accessible in the house and shocked within the first 3 minutes, that same loved one now has a 74% chance at survival. And this was truly an epiphany. Dr. Quirk, Dr. Mendoza, and myself have all worked codes in the emergency room together. And we know that if you're doing CPR on somebody, it's not a good day. And neurologically, they're probably not going to be intact coming out of the hospital. But we have seen those people who have gotten early defibrillation and have been able to walk out of the hospital a week later, thanking everybody, remembering their wife's name, remembering their family, and be able to enjoy another day. So why hasn't this really happened? If this is such a big issue and there's a dramatic change, I started looking at the current market, and the current market has really kind of missed the mark. And it's because these AEDs were designed about 20 years ago and have not been updated since. They're heavy, not portable, expensive, intimidating, and complicated. Commonly found in a glass case on a wall with lights and sirens and a sticker that says, "For trained personnel only," is sending the wrong message to the community. I have been taught since grade school I'm not allowed to access that device. I don't want to bring attention to me. This is somebody's most critical time in their life, and you are the only person that's really going to make a difference. It's not the paramedics. It's not the emergency room physician. It's not the cardiologist. It's truly the bystander at the side. So how do we break through that? And what do we look at for that? Well, we probably needed to reduce the price tag and make this friendly. But one of the biggest problems is we also need to identify where cardiac arrest is truly happening. 70% of all cardiac arrests happen in the home. So by targeting schools and public buildings, etc., and I believe in public access defibrillation, but by targeting those places only, we're missing the greatest amount of people that are having cardiac arrest. So we need to get this in the home. So anybody can use this anywhere at any time and be accessible to it. So why don't we treat this like a fire extinguisher or your first aid kit? We see a world where this can be treated like an EpiPen, and you go to the hospital, you're diagnosed with high risk factors of those 86 million Americans that we previously just talked about, and you are sent home with a prescription for an AED in your home that you can use. Heart Hero is going to be the lowest cost, easiest to use, and most portable AED, so anybody, anywhere, at any time can truly use it. So we have designed Heart Hero. I've been doing this for approximately 3 years now. We have a fully functional working prototype, and we are currently in the hardening phase of our device. The device currently sits at about 1.3 pounds, 6 inches by 6 inches, and about 1.5 inches tall. It utilizes store-bought batteries. We do have a relationship with Duracell because of this innovative design and how small we are. But what we're really proud about the Heart Heroes device is its ecosystem, its integration into the EMS system, into your phone, into the community. Now, no longer will your AED just sit on a wall, but it will be part of your life. When you unbox the AED and you get it, there's an online training video right from your app. It's easy onboarding and easy registration. Gives you real-time alerts of your device. Also gives you real-time alerts of your family's device. So should you want to see your mother, your daughter, your dad, your grandpa's AED, you can actually see that in real time. But let's take a step further. Where this really becomes also innovative is the safety manager is able to see all AEDs out of a geographical location in real time and see that those AEDs are up and running. So if you're the safety manager of the Empire State Building, instead of walking up every single flight of stairs, you can sit at your computer and immediately see that all AEDs are in line. And if an AED is pulled off the wall, you're immediately going to get that alert because the AED is able to sense that and be able to track it. But we're not done there. We have cellular Bluetooth capability to this. When you use the device, it will automatically call 911. We need to really simplify how to take care of somebody in cardiac arrest. So pads, that's all you need to do. Pull out the device, place the pads on there, and boom, the 911 system will be initiated and help will come to you. We're really arming Good Samaritans and the bystanders by doing this and focusing on what exactly needs to happen. We have looked at marketing. While our device is really, really cool, we actually see ourselves as more of a marketing company. This needs education in order for this to happen. Cardiac arrest is the #1 greatest killer. People don't know of a brand named AED. Heart Hero is going to change that. We have the current market, which sells about 200,000 AEDs each year. We have the early adopter market. These are companies that have very, very large AED budgets already. They're the telecom, the OSHA regulated companies, the construction sites. They have to buy by this and they already have it written up into their protocol. And then we have the consumer market. And this is truly just absolutely an untapped market. This is the mom and dad at their home. This is you and me wanting just security around. This is all of the high risk individuals. And we are working directly with Google currently on how to attack that market and increase our brand name. Our team is comprised of myself as the CEO, And then we have Jonathan Rogers, the Chief Financial Officer, and then Dr. Bill Cork here as the Chief Medical Officer. Dr. Bill Cork was one of the very first people that I ran this idea by, and we've kind of moved forward with this. Craig Bell is our private equity investor from our previous round. He also sits on our board currently. We have a multitude of strategic advisors that help guide the company to successful FDA approval and CE mark. We have multitudes scientific advisors from emergency medicine and cardiologists. Carrie Mendoza is on the phone with us. You can see here also. We do have partners. Duracell is one of our big ones, and we just included Google. We're very excited about that relationship. And then a bunch of engineering and design firms to ensure that we can bring this to the public at an affordable price tag in a really novel, innovative design. Our financials actually look very positive. We're very happy with the financials. Again, it's not just to create a device, but how do you get it into the market and how do you get it into the hands of people? We can create a device all day long if we're not fulfilling a need, and we are absolutely fulfilling a need here. In fiscal year 1, we're looking to be cash flow positive with CE mark and FDA mark. And then fiscal year 2, 3, and 4, we're also increasing on our revs that we're going to be pushing up to the over-the-counter approval, Canada and Asia in there. Our pro forma does not really take into account the consumer market. We have taken that out of the pro forma because it is a truly an unknown market in there. If we do, and when we do get that consumer market play, it is going to have a waterfall effect. And we've already identified our contract manufacturer that can fall into that waterfall effect. So should our device save a life and it hits up on Twitter or any social media and we wake up the next morning with 50,000 units, we'll be able to fulfill that with our contract manufacturer. And then this just grows that company much more. This funding round, we are in a Series A funding round. We're currently looking at $4 million. To date, we've secured about 2.5 of the $4 million. We do have a $15 million pre with this. Really notable events that will happen in this funding round is we're hardening our device. While we do have our fully functional working device, I specifically gave it over to another engineering firm who's already passed 2 AEDs through the FDA and has gotten approval. They're expert witnesses for patent infringements between AED companies. And I specifically gave them the device and said, break it and make it better. It is much more expensive to have a recall than it is to get it right the first time. And that's exactly what we're doing here at Heart Hero, is getting it right the first time. So that will get us back up to a fully functional device that's ready for validation, verification, testing. We'll also start working on our pre-submission, our FDA approval, and putting our packet together for CE mark. We will have a strategic hire in this round of sales and strategic officer. In fact, I have to say that we're about to bring him on, and this gentleman used to work at Philips as a strategic sales and officer for the Western region, and we're really excited to have him on the team. This round will not get us through the FDA approval. It will get us close to the FDA approval. Then we're looking at doing a debt round after that off of letters of intent and purchase orders. With angelMD, and part of why we're doing this is because we did win the ACEP innovation pitch of 2018. 19? Yeah. Oh, yeah. The ACEP innovation pitch of 2018. Sorry. And then we are currently accepted into the Future Innovation Hub for ACC, the American College of Cardiology, that we'll be pitching to next month too. But with this and winning that innovation pitch for ACEP, we did nothing more than pick up our phone and we had a request for 60,000 AED orders. It was incredible. We didn't do one marketing dollar to do that except collaborate and work with angelMD and work with ACEP on that. So it really kind of showed us that people are hungry for this futuristic device. I would like to thank you for your time and your opportunity today. Please go to our page and we will let you know more about what we're doing. John, I turn it back over to you.
Thank you, Gary. Now we're going to go ahead and go through some Q&A. And just a quick note to everyone watching this, if you have any questions either for Gary and his team or angelMD directly, there's a box here on the side of the Syndicate page that says Ask a Question. You can either click the button to ask it via email, or there's a phone number there that will link you to my team. We can get that answered by the correct person. So now, if either of our Syndicate leads have any questions, feel free to chime in at any time. I'll go ahead and start off with Gary. Now you showed kind of an impressive revenue ramp there, looking at the future for the company. Can you talk about the end game and how you see Heart Hero ultimately delivering a profitable return to its investors?
Yeah, absolutely. Thank you, John. To go back to that revenue model, the reason why we're so aggressive on this is because we know that it's a proven revenue model. There is a case study out there called Access Cardio. Access Cardio came out in the market in 2004, and they came out to the AED market with a device that was half the size, half the weight, and significantly cost effective. They ended up selling about 8,000 units in the first year and doing about $15 million in revenue. They absolutely took the market by storm and really shook it up. The problem with Access Cardio is they ran to the market with a minimal viable product, and it wasn't fully tested or vetted, and their shock button didn't work. This is exactly why we are taking our device to another engineering firm and asking them to break it, to ensure that it works every single time. And because of that, we have been able to engage this relationship with Duracell. They have given us access to their R&D and testing facility for free to ensure that this device works every single time. So then going forward from that revenue model into what is our potential exits? That is another great question. We have already been approached by two strategics asking us to start collaborating and talking with them on a potential merger exit. We found this to be very exciting. Obviously, they're two AED strategics, and they can see exactly what is happening and how this device is going to impact us. We see a potential exit when we submit in for our CE mark at the end of this year, and then our FDA mark at the PMA FDA submission at first quarter 2020. Our goal is to be under Christmas trees in 2020. So there is our potential exit. So we are designing the company as a turnkey operation. So should another company like an Aetna, CVS, Google, Amazon want to get into the game of a life-saving device and have their name attached to that, they can absolutely do that with our contract manufacturer and take the company over.
Perfect. Thank you, Dr. Quirk. Mendoza?
Gary, I'll ask Gary a question. Gary, both Dr. Mendoza and I are members of the American College of Emergency Physicians. Gary mentioned Heart Hero won the ACEP and angelMD Most Innovative Award for 2018 in the med device category. And I want to ask Gary, we're in San Diego. There's 8,000 emergency physicians there. What did they complain anything about the product? Did they give any guff back and forth? What were their thoughts on the product, and specifically anything negative?
Yeah, thank you, Dr. Cork, for that. So here I found this very interesting. One, we walked into the American College of Emergency Physicians. Something that they really hold dearly is innovating and being able to shock somebody. And what was truly novel about this is we're an AED. We're not meant for the emergency physicians. We're meant for the bystander. We were pitching a device to be able to relinquish that duty over to the bystanders, so then the physician then gets more beating hearts coming through the door, which makes everybody's day greater. They can enact with cardiologists, and then they can get up to the cath lab, get a box put in their chest in real time. They can see the data of what has happened. But what was funny about this is that, one, we had physicians actually handing us their credit card saying, "Can I buy this?" And then we had other physicians looking at our device going, "Where's the shock button?" And so that was a negative thing for most physicians, because they wanted that control of they're the person that's going to shock. And we have specifically designed this for the layperson. There is no shock button. This is a two-step process. You pull the pads, you put the pads on, 911 is initiated. The device then immediately takes over, only shocks 2 lethal rhythms, ventricular tachycardia and ventricular fibrillation. And with that, if you're in any other rhythm, all it's going to do is initiate 911. So you don't have to know why the person's down. You don't have to, as a bystander, make a diagnostic decision and go, hey, I think this person's having a heart attack, or I think this person's having pneumonia or whatever, or just had a stroke. The person's on the ground. You need to act, and that's what this device does. It's extremely safe. There is incredible AI and filtering system through the algorithm to be effective and only shock a lethal rhythm.
Thanks, Gary. I have a question for you. It's a bit of a two-parter. First, you mentioned that one of the pathway goals you have is to get an insurance billing code set up for this. So can you talk a little bit about that process and the risks it may entail? But also, you mentioned that you wanted to make this as common for homeowners as having a fire extinguisher in their house. You know, kind of going with the billing code option. How do you see that playing out? And is that something you'd lean on partnerships for, or is that a mission you see Heart Hero itself undertaking?
Yeah, John, fantastic questions. So let me take the first one, the insurance code. There is already an insurance code for AEDs. It's just not well executed because people don't know about it. And there hasn't been an affordable and portable AED to really enact on that, to leverage the cardiologists and the emergency room physicians and the hospitals in order to write for the script. But we look at this of doing this in an educational piece. If you go into the emergency room and your loved one is on the gurney and has chest pain, the average emergency room stay is 4 hours. But you may see that doctor only for 15 minutes total in that entire 4-hour stay. We live in a trust but verify society nowadays. The only access we have while in that emergency room is our phone, and we're going to go to our phone. And this is where our partnership with Google comes into play. By educating the public, by empowering them with data, they're better to have a real conversation with their physician of, hey, I see that maybe I'm at risk for cardiac arrest. Should I be going home with an AED? And that's a real conversation we can start to have. It also poses a conversation that creates a medical legal case. We could have lobbyists, we could try to push this from a billing code standard, but what's really going to push this from a billing code standard is creating a medical legal case for it. And why I'm really excited about that is because it's easy to get into the hands of the underserved community. And that's where I'm really passionate. We need CMS to be able to cover this so groups and individuals that otherwise this would be out of their reach and could not afford it now have the right to live, now have the right to save their family member with this device. We really see this as an EpiPen. If you go into the hospital with your sick kid that has an allergic reaction, you are absolutely going to be walking out of the hospital with an EpiPen. It is just gold standard that happens. We see in 5 years from now, when the Heart Hero device comes onto the market, that is going to be treated the same way. The second question was, John, remind me on the second question. It was.
Well, you sort of answered it by talking a little bit more about how, marketing efforts of how you get consumers to buy into this being as necessary of a product in their house as a fire extinguisher.
Yeah, we have some other interesting ways and partnerships. I absolutely see a way to get this into the house by using partnerships of other companies and leveraging
just, essentially, John, we have the medical component of it with Aetna, United, et cetera. We have anecdotal evidence that Blue Cross Blue Shield will pay for 80% of these devices. And secondarily, there's a significant role that life insurers may have a role in this. A life insurer their vested interest is the time value of money, and it pushes off the payment to one of their policyholders by keeping them alive. So it's very fascinating, not just on the medical insurance side of the equation, but the life insurance side of the equation is a very viable route for us for partnership and also for capital source.
Yeah, John, thanks, Bill Cork, Dr. Bill Cork, for jumping in there. John, the reason why we're kind of stuttering and looking at each other here is disclosing exactly that fact. It is very novel to have a partnership like that, and Bill Cork is absolutely a strategic advisor, and we're just eyeballing each other on should we disclose that over the internet right now, and I think we should because it's going to happen.
And full disclosure. John, full disclosure, I actually sold life insurance prior to medical school. I honestly sold it.
Well, that's good. That's good to hear. The other question I had kind of goes down a similar path. You mentioned key partnerships with Duracell and Google. I know there are always things about these that are confidential, but on a high level, from what you can share, can you describe some of the value that's driving the business?
Yeah, so the partnership with Google and with Duracell really gives us a lot of brand recognition. Immediately, we're going to be able to have a name brand company that people already trust backing us and helping us to succeed. So when you're looking at this, we have the potential of really becoming the household name for the AADs. What they are providing and supporting, like I said, for the Duracell one, is open access to their R&D and testing facility. Should you be in Afghanistan or in the back of a squad car in North Dakota, we're going to be able to test that in their testing facilities and get this device to be able to work and function. Duracell never wants their battery to look like the rate limiting step. It has to work every single time. So they're going to scrutinize it harder than the FDA would ever scrutinize it to ensure that it never falls back on them as bad PR. And we applaud them for that because we believe in that exact same mission. Our relationship with Google is still a little more confidential on exactly how we're utilizing them, but it is extremely novel and we're very excited about it.
Perfect.
I have a question.
Yeah, Carrie?
Yeah. So Gary, tell me, one interesting aspect of me being here in Illinois and Chicago, part of a big blue state where Medicaid's been expanded and the state is really on the hook for large amounts of costs related to Medicaid recipients. How do you see, leveraging, Heart Hero to help sort of decrease, costs through, life-saving, saving these lives earlier or getting them to the hospital earlier? How do you see that as attractive for, this community, this big sort of African-American community with a lot of risk factors who also often don't get ambulances to their locations as quickly as other parts of our city in Chicago?
Yeah, absolutely, Carrie. In fact, the American Heart Association just did a very big study on the fact that there are certain demographics that don't get access and are completely overlooked when it comes to cardiac arrest. And you identified one of those ethnicities that do exactly that. That is part of my push of why I want this covered in CMS system. So should anybody in that catch area, we can get that. But let's take this a step further. Cardiac arrest is not just the #1 greatest killer in the US. It also is one of the biggest financial burden. It burdens our society to a tune of $400 billion. And what I mean by that is there's a direct and indirect cost of cardiac arrest. Should there be the direct cost of the hospital stay, the length of time, as you know, and as Dr. Cork knows, when we take care of somebody in the emergency room from cardiac arrest, typically what happens is the paramedics revive them with the ACLS drugs. They get into the emergency room and we continue to keep them alive. They're on a ventilator and they go up to ICU. And in about 3 weeks from that day, they end up dying in the ICU. That's a lot of healthcare dollars that is spent on trying to revive and keep that person around. If early defibrillation would have happened to that person, like I said, they would have lower acuity and been able to walk out of the hospital. So there's the direct cost. But typically when you're looking at people, they end up dying around the age of 55, 65. They have several productive years of their life to, one, financially make money for their family, keep their family around, and pay taxes. And when you start taking that all into account, that's the financial burden that really is impacting, that we will be able to make an impact on this nation by decreasing that. But then you ask, how do we impact a city like Chicago? Well, we impact them by having a life-saving ecosystem where we can alert and tell you in real time where an AED is, if should a cardiac arrest happen, and not burden the city with the EMS funds there. We have it stored up in our own cloud system. But then also our AED is about half the cost, if not 1/3 the cost of current AEDs on the market. And there was just an initiative that was passed out where a train company bought 57 AEDs at the tune of $270,000. And I think that should actually be looked at, because that comes out to about $3,000, a little more than $3,000 for each AED, when realistically we can get that to them and facilitate their entire mission at the tune of about $50,000. We just saved that organization $150,000. The school districts, the government buildings, they're all going to be burdened by the same thing, that as we're increasing mandates and more mandates are being passed for AEDs, they're going to be burdened by the cost. And if we're able to decrease that, and with our ecosystem also decrease the real-time maintenance of this, we're going to start significantly decreasing costs and helping out cities to achieve a better goal.
Yeah, and just to piggyback on that as well, a lot of other interesting things going on in Chicago and these other big cities, where the hospitals actually, are at risk for a lot of dollars with these patients that, keep coming back because of a lot of social issues, just with housing, can't get their meds, et cetera, that they're actually spending money to on apartment buildings to house, homeless people who keep coming back to the ER. So I think hospitals and cities themselves also would be open to a spend on something that is relatively low cost but so high yield if it can decrease morbidity for this patient population that they're really now in charge of the finances for.
Mm-hmm. Absolutely.
Thank you very much. I appreciate it. That's about all the time we have for today. But once again, if anyone has a follow-up question while you're watching this, please feel free to utilize the Ask a Question box here on the Syndicate page. If you are interested in investing, below are the necessary company materials that you can review for this opportunity, which is Health Heroes term sheet, an executive summary, a copy of this pitch deck you've seen today, and the PPM into which you'll be ultimately investing through angelMD Syndicate. A quick note that in order to invest in an angelMD Syndicate, you must be an accredited investor based on US accreditation standards. The simplest way to achieve those as an individual, or if you're investing through an entity like an LLC you have set up for yourself, is either by having a net worth greater than $1 million, less the value of your primary residence, or for the past 2 complete tax years, you've earned an income of at least $200,000 if you're single, or $300,000 if you're married and filed jointly. If you have any other questions on the process, please feel free to reach out at any time. Otherwise, we thank you for your time. Have a great day.